Orthopedic pain is becoming only more prevalent and pervasive pan-India, which raises the question, is it perhaps time we revisit our screening, our diagnosis, prevention and treatment protocols? And when it comes to regenerative orthopedic treatment solutions, are they truly an effective alternative to surgery? And what are the misconceptions, perhaps, that continue to loom large? Well, we're joined in studio by a highly distinguished and decorated panel of domain experts to tackle this very topic. With that, welcome to our special feature. Allow me to introduce our guests. We have with us the CEO Emeritus of Regenexx, Wayne Shellhammer, Director of OrthoRenew, Dr. Paras Shah, an interventional orthopedic expert at OrthoRenew Mumbai, Dr. Suri Bhagat. Dr. Shah, Dr. Bhagat, Wayne, thank you so much for taking the time to join us in studio. It's such an honor to have you with us.
Thank you.
Thank you.
It's a pleasure to be in India.
Welcome. And with that, I'd love to kick off the conversation with you, Dr. Shah. And for sake of some context setting and for the benefit of our viewers, if you could perhaps take a walk down memory lane for a second and describe your journey as an interventional orthopedic expert and a pain management specialist, and ultimately what drew you to collaborate with Regenexx.
Okay, so I'm originally from Bombay, did my medical education at Grand Medical College and at KEM Hospital. After that, I migrated to the United States. In the US, I did my residency training in physical medicine rehabilitation and pain management fellowship from Montefiore Medical Center in New York. And after finishing the residency and fellowship, I was debating whether should I get into private practice or should I continue the traditional hospital employment opportunities. While during the residency and fellowship, what I learned is that as a pain management expert, we were treating joint pain, musculoskeletal disorders, and spinal conditions with traditional treatments which are very prevalent across the world. We used to treat patients with medications, non-steroidal anti-inflammatory medications, opioids. We used to treat patients with physical therapy. If those things didn't work, we used to do interventions where pretty much we were doing steroid injections and viscosupplementations. And in the due course, what was happening is patients were getting some relief, but patients were constantly coming back for more pain relief because it was never
temporary.
It was temporary. It was never a permanent or a long-term answer. So looking for, solutions where there is long-term pain relief for the patients, I started researching what else could I do. And we had heard about PRP treatments during my training. And I came across Regenexx. And after evaluating Regenexx, I realized that they have patented treatments and opportunities to treat orthopedic conditions in a non-surgical manner using platelets and mesenchymal cells. And that intrigued me. So that decision, the thought process of treating orthopedic conditions non-surgically, giving long-term pain relief,
right,
made me join Regenexx. So I joined Regenexx with some doubts in my mind of how this is going to go. And of course, it was new, never tried and tested. So joined Regenexx, took the required training, which was necessary, and started a location of Regenexx in Kansas City, where I was appointed as the director of the clinic. And in the due course, of course, I started implementing the treatments using patients' own platelets and mesenchymal cells for treating various orthopedic conditions. And over a period of 6 months to 6 to 12 months, I realized how effective it was and how much significant change it had in patients' quality of life, pain, and function. And patients were very happy. And these patients whom I saw were those patients who were told that they need a knee replacement surgery because of a bad knee, or they needed arthroscopic surgery for a meniscal tear, or they needed a rotator cuff, arthroscopic surgery of the shoulder for a rotator cuff tear or a labral tear. So these were strong, the patients who came to me were coming with strong indications of needing to do surgery, and they were looking at an alternative option, because once surgery is done, the rehab is extensive, the recovery is long, and it's never going to be a natural tissue,
Sure.
which they were having.
Right.
And after surgery also, during my residency and fellowship, we learned that when we send the patients used to still come back with pain. So at the end of the day, you're treating these patients, trying to get surgery done, trying to help the patient. Patient is still coming back with pain and poor function and quality of life.
Sure.
And then when I started treating patients with the Regenexx's patented protocols, I realized that their pain got better, their function got better, their quality of life got better. So and without surgery. And this went on, and 6 months, 12 months, 1 year, further second year, and we realized that we treated every possible joint condition with these. 80% of the joint, 80 to 90% of the joint conditions we could treat, besides fractures.
It's so heartening to hear that.
Yeah, so that changed my philosophy on treating these musculoskeletal and orthopedic disorders.
Sure.
And I became more passionate about it, rather than just being a physician treating patients in the office. It became a passion for me. And so that's how and then since then I've never looked back, and I believe in what I do, and it's a wonderful experience. And
Oh,
I never
absolutely.
feel I've worked.
And thank you for sharing that, because so much of the evidence lies in the anecdotes, right? And speaking of evidence, I want to come to you now, Wayne, building on some of Dr. Shah's observations, right? To what extent do you believe that Regenexx has transformed orthopedic treatment abroad? Before we take the conversation a bit closer to home, walk us through some of the success rates in the UK, or perhaps across Europe, Australia, the US, where you're based, so on and so forth.
So Regenexx is very unique in that our founder, Dr. Chris Centeno, was wise enough when he first started testing whether or not platelets or mesenchymal cells could make a difference. He started a registry.
Okay.
Today we have over 2,000 treatments tracked in that registry. So do we know if this works? We have 2,000 procedures that say it does.
Right.
200,000 that say it does. So as Dr. Shah was saying, we can identify where it will work, and we can identify where it won't work.
Sure.
And so one of the things that we like to say is we won't treat you if we can't help you. So for example, someone who has 95% of the crown of their hip full of arthritis, we're probably not going to be able to relieve them.
And you acknowledge those
pain.
limitations.
And we acknowledge, and we don't want to treat those folks, because we
Right.
want success stories.
Right.
So we refer those folks on to the orthopedic surgeons. But to someone who has an ACL tear, for example,
Right.
we know that 90% of our treatment of an ACL tear, unless it's fully retracted, will fully recover. And they'll do that in 30 days. A surgical repair is 90 days minimum, and has weakened the ligament, where a regenerative treatment puts it back to its normal state. It heals back to its normal strength. So we now know, over the course of 20 years of keeping track of all of this, what works and what doesn't work.
All right.
And it doesn't matter if you're in Europe or India or the United States. Tissue is tissue. Yeah.
Well, Dr. Paras gave us a bit of an overview of the Regenexx and OrthoRenew partnership and how it was originally conceptualized. But is OrthoRenew, Regenexx's only India-based partner?
It is our only India-based partner, and we're very excited about that they are, because their vision is not to have a clinic in India. Their vision is to grow, as we did in the United States, an affiliation network of providers, qualified providers, across all of India. India, as you do your homework on India, does not do pain management well. It's minimal. It's a minimal business here. So people walk around in pain in their spine, their knees, their shoulders,
Right.
pretty regularly.
Right.
We can relieve that, and we can relieve that in a manner with which they can afford in India. And so the development plan to work with OrthoRenew Regentech is to be able to replicate the affiliation or franchise model, depending what terminology you're comfortable with,
Sure.
in India,
Right.
so that we can service this very large population of painful people, people who have pain.
Right.
And that's exciting to us because that was our goal in the United States, and to have a partner that can develop it in a culture like India is really exciting.
And so I'm going to come to you in a minute with how so many Indians have almost resigned to the pain and assumed it's simply a part of life. But before I do so, another question for you, Dr. Shah. When we look at the West, all right, there is a gradual but perhaps increasing migration towards non-surgical intervention when it comes to orthopedic treatment. How does that compare to what's happening on ground here in India, perhaps more specifically through the lens of the patient experience?
So yeah, in the West, the non-surgical treatments offered by Regenexx has grown significantly. You know, since the time I joined to now,
Right.
there were about 30 centers, and now they have 130 centers. Number two is the treatments which Wayne was talking about. So we have about 200,000 plus patients who are treated and tracked in a registry.
Right.
And that itself signifies what is the potential advantages for this treatment to our Indian population.
Sure.
As far as when Wayne was talking about treating the tissue, whether it's in whichever part of the world,
Right.
you are going to treat it the same way we do it in the United States. And in the Indian community, what I have noticed is, and as you rightly said, that people believe that pain is normal.
Right.
They have to continue doing their things without, actively intervening.
Sure.
The realization that if they're pain-free, their quality of life and their function can significantly improve
Sure.
is there and not there. The awareness in the population has to increase.
Right.
And the other thing is, with Regenexx, the non-surgical treatment options are a perfect opportunity to help the Indian population, because the treatments give them relief in matter of weeks, number one. Number two, they are non-surgical, so they can go back to doing whatever they want to do faster.
Right.
The time off from doing the things which they love to do, whether it's sports or going back to work,
Right.
is significantly reduced. And what I feel is every medical specialty has limitations.
It does.
As Wayne said, we don't treat everybody who walks in the door.
Right.
We have specific indications and specific pathologies which we can treat, and if we cannot, we tell the patient up front.
Right.
So given that situation, what I feel is this treatment there is a big gap in India at the current time between living with pain and surgery.
Sure.
And that gap itself can be fixed with this,
Right.
filled with this treatment, can be fixed with this treatment, and this can be given to the patient. So, there is another option for patients to consider, which is non-surgical.
And perhaps there's an awareness gap as well, Wayne, right? Which is perhaps what even brings you to our country in the first place. So how do you eye that market, and where do you think the opportunity lies?
That's the million patient question, is how do we get the word out,
Right.
And in today's world, it's easier because we can use the digital, the world of media like this and the digital world. But it comes down to, who do you trust as a
Correct.
patient to a doctor, right? So our job is to educate physicians about the difference between pain in a constant basis, pain that can be relieved, and when does surgery need to be put in play.
Sure.
And so our job as development folks is to educate the medical community.
Right.
Patients will follow the advice of medical community.
Sure.
Unless someone's been treated in their family, they've had a successful outcome, then they'll say, I'll just do what you did.
Right.
And we're 20 years old in the United States, so we have a lot of that now.
Right.
But when we were 5 years old, we didn't have so much of that.
Right.
And then the other part of it is you have to convince orthopedic surgeons, who are the first people everyone goes to when they have an ache in their joints,
Sure.
right? As you think of, let's go to an orthopedic surgeon, right?
Right.
Because they take care of joints. Well, they only have one trick in their bag:
Surgery.
surgery. Well, we need to help them learn that there is a really good place for surgery.
Right.
But 60% of the elective surgeries don't need to be done because they can be treated interventionally, and you're going to get a better outcome interventionally because you don't weaken whatever you're working on surgically. It's a little bit like back in the 1980s and 90s when cardiac surgery was the only solution to chest pain, right? You had a problem with chest, you had cardiac surgery. Then somebody invented this thing called the stent, and all of a sudden you could get a stent and not have open heart surgery and get all your blood flow back. Right. And I was in the cardiac consulting business at that time, and it changed the world. Right. And the amount of cardiac surgery dropped 50% in 5 years. Staggering. Over the use of stents. That's the trail that this will develop into.
No, that's of such relevance given that India is now considered to be the cardiovascular capital as well. Yeah. Right. But coming to you now, Dr. Bhagat, let's bring some facts and figures into the conversation. My understanding is that over 1/6 of the Indian population suffers from musculoskeletal pain, right? And then beyond that, I believe that over 55 million people suffer from osteoarthritis. 1 out of every 3 women in this country, right, suffer from arthritis. So is non-surgical intervention the answer here, given the sheer magnitude of the problem?
So absolutely, you said very correctly. We see so many patients of osteoarthritis. And osteoarthritis is now labeled as a disease. It is not just the condition. Right. And it can affect many parts of the body, like multiple joints and spine. Sure. So we need to tackle that. And you said very correctly, women are 50 to 60% of women today in perimenopausal age or after menopause, the arthritis sets in. There is a metabolic disturbance and hormonal imbalance, which puts weight, they gain weight, and then arthritis and a vicious cycle of pain sets in. Right. And there are multiple other conditions. So and as Dr. Shah was mentioning, and we know that about patients, there is a myth that you have to bear your pain. It is taught from childhood. Learn to live with it. Yeah, learn to live with it. So to complain about the pain is you are not strong, you are weak. So that is what has been going on. And as a pain specialist, I'm a super specialty of anesthesia. And I've been seeing pain patients right from like 25 years. So now, 5 years ago, I was checking on Regenexx website and I was looking for this condition to come to India, the platelet-rich plasma. So whatever kits were available in our country, I was, experimenting and checking out the platelet concentration and not getting the results what I wanted. So I was just, I wrote to them and said that why don't we bring this technology here? Yeah. And then I met Dr. Shah and Hemal. So this happened, and that is what we are here for, to bring this technology to and make awareness to the population that your pain of osteoarthritis, you can treat it non-surgically, and surgery is not always an option. Sure. So the only option. Not the only option. Correct. Yeah. So you have a big gap between the onset of the pain and the surgery. So we are told that you can, as long as you can bear your pain, continue, and then one fine day you will need a surgery. But with our treatment, we can halt that. We can halt the progression of your inflammation. Inflammation is the main thing which comes with osteoarthritis. Right. So if we remove that toxic chemicals and halt that inflammation, your joints and other structures, which we treat multiple structures and will come to know as we speak ahead, will last longer.
Can I add to that? So one of the reasons that the Regenexx treatment plans are effective is that Dr. Centeno, when he started doing this, figured out that high concentrations of platelets, whether it's platelet-rich plasma or mesenchymal cells, had to be done in high concentrations. So he spent 2 years in a lab developing a patented process to create concentrations of anywhere from 8x your normal level, to 30x your normal level. And when you get an injection of 20x your normal cell counts or your normal platelets, you get a positive recovery, right? And that's what Regenexx is why it's the gold standard. Because we have patented, and we're the only folks in the marketplace in the world who can get those higher concentrations. And that is one of the other exciting parts about bringing the outcomes to India, is because we know that we can separate ourselves from a bunch of other folks out there who are saying, well, we have PRP.
Right.
You do. You can call 2X PRP, but it won't do anything for you. And so it's important to know that there's only one standard out there that really provides enough treatment, injectate, to make a difference.
So a two-part question to the two of our gentlemen here, and I'll start with you, Wayne. When we talk about affordability of the Regenexx treatment plans and the solutions, how does it compare to existing options that patients can currently avail, given that this becomes an all the more critical question in the context of the India market, which of course is inherently cost sensitive?
So in the comparison of the two countries, the United States to India, the problem is the same, and that is the insurance payers are learning about this new technology.
Sure.
So they're not sure if they should cover it or not cover it. In the United States in the last 3 years, we've had a 7,500% increase in insurance payers covering the benefit.
It's staggering.
It's staggering. The cost avoidance or cost savings to them is somewhere between 40 and 70% per procedure. So when you start calculating that into the volume of orthopedics, which is generally their second or third highest cost item, this offers them a tremendous cost savings while offering as good as or better outcomes. So it's a tremendous opportunity for the insurance community to deliver better benefits at less cost. For private pay, it's the same thing, create affordability.
Right.
And so our target in India is to be able to be in the neighborhood of 1/10 or so of what the insurance or the surgical offset cost would be.
Sure.
So if we can provide the same benefit at 1/10 of the cost, we've done a good service for the private pay.
Well, Dr. Shah,
I think, Wayne, you're right. And I think in India, we will see that same cost reductions of 40 to 70% in the cost compared to the traditional surgical option for treating joint pathologies. And that's a significant saving, whether it's paid by the insurance or it's paid by the common person,
Right.
Out-of-pocket expense.
well, Wayne, I've got a follow-up question for you here now, because, you know, the Indian population is aging.
Yes.
All right, lifespans are increasing. That's happening on the one hand. On the other hand, you've got this aspiring youth who have an all the more, let's just call it resolve to pursue athletics, whether
Right.
it be professionally, whether it be recreationally, right? At an amateur level or as a pro. The desire is there, correct? So how might a solution like this make a difference vis-a-vis our larger athletic landscape, which of course includes the athletes themselves, the therapists, the physicians? There's so many stakeholders in this ecosystem that this can impact.
So I love this question, because sports are the first thing everyone thinks about. Is this going to make a difference in the sports world? The answer to that is absolutely it will, but it's an education process. Again, what do all teams have? They have an orthopedic surgeon on their team, right, as a team doctor, because all those joint injuries are going to be treated by the orthopod, right? Well, they're learning that, yeah, we can fix everybody who has an injury, but we may take them out for a whole season by doing it that way. And we may only get a 60% success rate by doing it that way. Regenexx and our treatment protocols, our treatment plans, can improve that success rate significantly, because your body wants to heal itself. It just needs a little help.
Right.
Right? And that's the whole point of the injectate. We're just going to give it that push. Right? And with that, as Dr. Shah has already pointed out, the recovery is quicker, much faster,
Right.
so that athlete gets back to work
Right.
much quicker.
Right.
And whether you're 12 years old, 14, 16 years old, and by the way, anybody under 20 who has an injury should never see a surgeon unless it's not repairable any other way. Because once you have that surgery, you've set yourself up for some additional surgeries much later on in life. You have an ACL fixed surgically, I'll guarantee you're going to have knee problems 20 years from now. That's a promise. So avoiding that in the youth is a big deal and will change the orthopedic demand 20 years from now. And that's a big deal. But in the aging population that we still need to take care of,
Yes.
the cells, because they're your cells, can go back to work in you quickly. We just need to concentrate them.
Right.
And that's the difference between doing the treatment protocols that we do versus someone else's. We'll get your body regenerating itself. I don't care what age you are. It just doesn't, if you're 15 years old and working on a shoulder injury,
Right.
I don't need 30X because I'm 15.
Right.
My body's pretty aggressively working.
Sure.
So I can use a less concentration, as the doctors can confirm.
Absolutely.
But at my age,
Yeah.
and I'm in my 70s, and I had my shoulders done 4 years ago, I needed a 24X injection to get my body to recover. But I had both shoulders done instead of replaced, pain-free, full range of motion.
It just gives so many patients so much hope.
Exactly, yeah.
Right.
Just to add to that, the sports fraternity in India, as you said, is growing, and it's, there are people with all kinds of levels of competence.
Yes.
So previously this treatment, I don't want to name folks, but
We can't.
we can't name them, but there are a lot of sports personnel who have had this treatment done at a very expensive price. And now when the treatment is come down to such a, that we have evolved over time,
Right.
that this can be offered to a common man and a cricketer, or a person who's playing kabaddi and has hurt something in the knee,
Right.
or if somebody is bowling and has developed tendinitis,
Sure.
or a shoulder issue,
Sure.
we can treat them on an outpatient basis and avoid unnecessary surgery for them, and they can get back to doing what they want to do quicker.
Well, I certainly hope all our athletes out there are listening.
Yes.
And coming to you now, Dr. Bhagat, given some of the on-ground realities in this country, in your view, what's it going to take for this solution, this non-surgical approach to orthopedic intervention and treatment to see more traction?
I would say awareness, what we are doing currently.
Yeah.
So awareness, bringing to our medical colleagues, to our family members. So we have started treating our family members. So
Sure.
they've got confidence now. We have patients bringing patients by word of mouth.
Right.
Then we have our own community, like my pain specialist guys who will be joining, and they are learning this technique and they will bring it to their patients. So that's how the chain reaction will start, that it will spread like wildfire.
It has to start somewhere. All right. And, Dr. Shah, coming to you now, conversations around back pain, shoulder pain, let's call it, slip disc bulge, and the list goes on and on and on. It's become so commonplace. It's a part of everyday conversation, right? So can an approach like this ultimately address those issues? Walk us through the severity of the case and where this solution applies.
So pretty much any joint in the body we can treat, whether it's in the neck, whether it's in the lumbar spine, whether it's in the shoulder, whether it's in the elbow, hand, wrist, knee, ankle. The concept is the same. Joint has certain common structures that are ligaments, tendons, cartilage, bones, muscles surrounding it, and we treat all of it. Our specialty of interventional orthopedics, which is powered by Regenexx, it treats the joint as a whole.
Right.
We just don't look at the cartilage and make a decision, okay, you need this and we can't do this.
Sure.
When we do evaluation of joints, peripheral joints, we do ultrasound assessments on patients on a regular basis. And on that ultrasound assessment, we can tell 80% of the time what is happening to the joint.
Right.
Of course, 20% of the time, to see the deeper structures in the joint, we need to do an MRI. But 80% of the time, we can make a conclusion that this person can benefit with this treatment or not. Same thing is there in the spine. As age progresses, as the other joints get affected, even the spine gets affected.
Of course.
And we firmly believe that if you tackle a problem earlier,
Right.
you can prevent progression
Sure.
of the issues in the joints, or you can delay the progression
Sure.
and have a comfortable lifestyle.
Right.
So in cases of spine, of course, we do physical assessments, exams and all that, but a lot of times MRI is necessary. And after we get the results, then based on the results, patient symptoms, patient's exam, and the correlationship with the MRI, we can tell the patients, okay, we can help you or we cannot.
And this
and
is
the,
how.
And the treatments are very simple. There are two treatments. It's not a complicated situation. One is high dose platelet treatment, and the secondly is high dose, highly concentrated mesenchymal cell treatment. So we just have to decide, okay, based on this pathology, should we use platelets, or based on the pathology, we should use the mesenchymal cells from the bone marrow,
Right.
or the last option is, sorry, we cannot help you. You may need to go and see a surgeon to consider interventions.
Yeah, fair enough. And
So we treat all the joints, and Wayne, as he said, he's treated his shoulders. I think you had treatment for the spine too,
I'm
right?
a walking billboard about the spine. At age 69, I had my spine treated. I had the standard old man problems with your back, right? Sciatica is the common term, or radiculopathy, the medical term, but you know, L4, L5, L6, S1, everybody in the world's got a backache, right? and that's where it's at. I had platelets done in my spine 4 years ago. I had to quit golfing because I couldn't rotate my back. I couldn't bend over to pick the golf ball up if I got it in the hole. Today I'm a 9 handicap again, playing great golf because my shoulders rotate and so does my back.
Sure.
Totally pain-free.
right. Well, look, seems to me the proof lies in the pudding.
Yeah,
Right,
to me, it's always, does it actually work? I'm a walking billboard to say my shoulders and spine are fine, and I'm not a young man.
And just to add to that, the reason we thought about the Indian market is, you know, I mean, we have parents coming to America all the time to visit us. And my mother-in-law came to see us, and she was having pain in the shoulder. One shoulder she had subluxated and dislocated multiple times. So she needed surgery, and she called us, and we said, okay, I think that's a fair thing to do, and get the surgery done.
Right.
So she visited us after that, and she had shoulder pain on the right side. And I said, my wife said, why don't you look at her and see if we can help her? And we evaluated her, assessed her, and I took her permission, and she agreed to do the platelet treatment. She did the platelet treatment, I think 3 years back, and she's still pain-free, doing everything what she is able to do, and she's 80 years old.
Yeah.
So that very fact that I could treat my own relatives made me think harder and made me make that decision, okay, let's take this to India, and we are here now.
I have treated my father-in-law who is 85. So
My
he had a knee
goodness.
replacement in one knee.
Yes.
Other knee needed platelets treatment 3 years ago.
A direct comparison there.
Yeah.
So this panel isn't just talking the talk, they're walking the walk.
Exactly.
We've treated our own family members, relatives,
Sure.
and they are doing fantastic.
Some of us are walking because of it.
One more feedback I would like to give to one of our patients who came with her mother-in-law and the daughter-in-law, the duo. They got treated and they were worrying about insurance initially. But once the treatment was done and after the recovery they saw, the daughter-in-law thanked us that, you know, otherwise if she had a knee replacement, I would have had a 1 month leave from my job and look after her. So we are saving the person's time who is doing the intervention as well as the person who is looking after, because in India we need one person as a help, right? And their life goes for a toss for a while, taking care of the ailment.
And these everyday anecdotes are so impactful because they're all the more relatable to the audience, to our viewers.
And just to add another thing is, as Surabhi is talking about treating knees, and you asked me about treating multiple joints, the beauty of this treatment is you can treat multiple joints for the same patient at the same time. That's number one. Number two, our evaluations are such that you don't have to see a knee specialist to treat the knee and shoulder specialist to treat a shoulder, or an ankle specialist to treat the ankle. We evaluate all joints, and as I told you, our treatment plans are very simple. And once you decide, okay, I want to treat 2 joints together, you simply draw more blood, you extract more, isolate more platelets with the patented lab processing technique which we have, and treat multiple structures in multiple joints together. So in one visit, depending on the pathology, I have treated 5 to 6 joints at one time. And the recovery is in 6 weeks
Yeah.
with all. So it's not like, okay, one recovers a little less and one recovers a little more. With the platelet treatment, we see recovery in 12 weeks. With the patented bone marrow treatment, which we use mesenchymal cells, the recovery is in 3 months, and it just gets better and better and better.
Well, Dr. Shah, thank you for breaking it down in such tangible terms, and to the entire panel really for the layman language, because I think that's key in terms of the message actually disseminating. And by way of closing comments, and I'll pose this last question to all 3 of my panelists, starting with you, Wayne. I think in the road towards eradicating orthopedic pain in this country, and perhaps well beyond, a long road lies ahead, right? We're perhaps only scratching the surface. But conversations like this certainly make for a critical, first step. That said, any parting message you'd like to leave our viewers with this afternoon?
2 things from my perspective. One is, don't be fooled by someone who says, I can give you PRP and take care of you. Make sure you understand what they want to give you. And if it's from a kit, then don't waste your money. And if they're not going to use image guidance to place the injectate, don't waste your money, because you can't just blindly put this stuff in there and think it's going to do something. It needs to go to the injury. So that's my first comment, is don't make a mistake.
Right.
So don't pick a provider that can't do it right. And right now we're the gold standard. And I think we'll remain there. My second thing for India is change. Don't be afraid of change. This is a change in healthcare, but so was the cardiac stent, right? And look at its place in India today, right? The same thing should happen in the orthopedic space, is that a change in innovation is a change for the better in healthcare, just like the cardiac stent. And this is going to be that in orthopedics.
Phenomenal.
Yeah.
Coming to you, Surbhi.
So we were speaking of change, and since having worked in the UK and South India and traveled the globe, we know that pain is ubiquitous. Osteoarthritic conditions are not avoidable, we cannot eradicate it.
Right.
But life gives us one choice, so we can make that choice to treat it or halt it early and choose OrthoRenew, I would say, to become pain-free.
And coming to you now, sir, I'll give you the last word.
So with Regenexx, with our treatments, I want to have a strong message which says, enhance and use your body's capacity to heal, and use your own blood-based platelets and mesenchymal cells to treat your orthopedic and musculoskeletal conditions. You will be pain-free without surgery, and you will be able to get back to your sporting activities in a quick manner without any surgical intervention, and you will see that your joint is stronger than what it was before.
Well, Dr. Shah, Dr. Bhagat, Wayne, thank you so much for taking the time to join us in studio, and we wish you and your teams all the continued success.
Thank you.